Welcome to the Empowerment Zone, brought to you by South Dade NAACP, where we share trustworthy information, uplift local voices, and connect you to the resources and pathways that support thriving, one conversation, one connection, and one action at a time. It is where South Miami-Dade listens, learns, and leads.
Welcome to another edition of the Empowerment Zone. My name is Harold Ford. I'm your host, and we thank you for tuning in and listening in. With us today, we have two very special guests, Miss LaWanda Bragg-Smith and Miss Mickey Thompson, who are going to be joining us today on a discussion about sickle cell, both the disorder and how we can definitely help those who are impacted by this particular disease. So with that said, welcome.
Good morning.
Ms. Bragg, can you tell the family a little bit about yourself?
Well, I'm currently a wife, a mother of two biological daughters, one bonus daughter. I am the founder and CEO of Courtney Vega Sports Athletic Foundation. I've been an educator for 25 years. So the organization kind of embodies everybody.
Amen. Amen. Thank you. And Ms. Thompson,
Hey.
retired nurse, medical professional.
Mhm.
Please introduce yourself to the family.
Good morning. I'm Mickey Thompson. I am a healthcare consultant now. As he said, I'm a retired administrator from Baptist Health of South Florida, South Miami Hospital. I now help and work with individuals and organizations on various equity and disparity types of community health-related issues. One being like sickle cell awareness and education right now.
Awesome. Awesome. Well, thank you all for coming out today to have this conversation. And beginning, what is the Courtney Vega Sport Athletic Foundation? I can't remember all of that. But
CVSAF is fine.
Okay.
Well, Courtney Vega SA Foundation is a Florida nonprofit organization that was created and designed to raise awareness of sickle cell disease, promote advocacy, improve the quality of life for individuals with sickle cell. One of the most important tasks that we have charged ourselves with is eliminating the sickle cell illiteracy and empowering the sickle cell community as a whole. The organization started with a conversation with my youngest daughter, Courtney. She was the athlete. She was an elite track and field runner, and she was asked one day, "Why do you run?" And she was about 6.5, 7 at this time. And she said, "I run because my sister Asia can't run." And my heart was pierced.
Wow.
And I said, okay, I have to do something. There are other organizations for sickle cell. However, in the Homestead community, it was nothing south.
Correct.
And the challenge was for the individual warriors couldn't get north to the resources. So with her making that profound statement of selflessness about her sister, I said, okay, I need to do something. And in February 2014 is when I launched Courtney Vega Sports Athletic Foundation. The name embodies her because of her statement.
Right.
The sickle cell advocacy is because of my oldest daughter, Asia, and the educational aspect is because I'm an educator.
Amen. And we had a chance to work together.
We did. We did.
In my role as the executive director of the Sickle Cell Miami Foundation.
Yes, we did.
And we are able to assist in bringing, I guess, the walk that you're still doing.
Yes.
Annual walk, and help you get that thing organized. And I'm glad to see that it's still moving forward at this.
My very first walk, we partnered on that walk.
Yes.
And we'll be doing our 11th annual.
Amen.
September 26th this year.
That's awesome. That's awesome. So I'm grateful for it. And also, Mickey, you met not only through church, but also through the Sickle Cell Miami Foundation. And
Yes.
please, I want you to break down for the family, what is sickle cell disease? Because not everybody knows, not everybody understands. And if you could break down the difference between sickle cell disease and sickle cell trait.
Okay, and I'll lend to LaWanda on that. The sickle cell disease involves the traits.
Mm-hmm.
And one of the, there's a normal trait, and then there's the sickle cell trait that they have that are combined together. It's very interesting because my family was very involved and still is involved with sickle cell, because my granddaughter, Khadijah Jackson Nicholson, had the trait.
Okay.
But she had the full-blown HBSS form of the sickle cell, which is one of the worst. And it's the most common.
Gotcha.
Which sent her into crisis several times. And I think what really brought me more so into it was the fact that, because based on being respiratory related and educated, when she had the crisis and she sickled mostly in her lungs. So the pain associated with it, I know we'll talk about that a little bit more, it just blew me away. Because the first time they told me they had to give her morphine because of the pain level and the crisis she was going through. It's like, we give this to the adult patients.
Right.
Okay, and she's only like 8 years old.
Right.
And it bothered me. But she went through crisis. And then there's that trait where we always thought if you had sickle cell trait, there was no problem.
Right.
You were okay. You know, you could do all that you wanted to do.
Right.
But we learned that there was a different side of that, which is part of what I want to talk to. So in our family, we had the daughter, my granddaughter, that had the full-blown sickle cell, who, thank God, went through the bone marrow transplant, where we were able to find a donor, because it was very difficult finding donors that match the patients. And her brother happened to be her donor.
Right.
So she went through that at the age of 12. And she's come full circle now.
Amen.
Because she is also a registered nurse.
Awesome.
In Atlanta right now, working in the hematology department.
Awesome.
Where she's working with sickle cell patients, cancer patients, giving them the IV infusions and the chemotherapy.
Awesome.
And still working with sickle cell, because she was concerned about that chronic pain level that the doctors don't really be aware of too. But moving down the line, the trait, my grandson, with the trait, developed this rare form of cancer, renal cancer, that affects young boys, teens, but mostly young boys between the age of 25 and 30, with the cancer.
Gotcha.
The biggest concern is that by the time they're diagnosed, they're already in stage 4.
Wow.
Which was in his case.
Wow.
So I call him my fallen warrior,
Okay.
who died. It's about 6 years now.
Okay.
And I promise that I will continue his legacy on educating and making people more aware about the renal medullary cancer that is caused by the sickle cell trait.
Right. Gotcha.
And during his time, you'll see I'm wearing my T-shirt.
Hey.
During his time of going through the cancer treatments, he created this shirt because he wanted to just box out cancer and educate us a little bit more.
I love it. And when we talk about educating people about sickle cell, and one thing I've often constantly reiterated and informed people of is that when individuals have sickle cell, they're in daily pain. They're constantly in pain, whether it's mild or major. There's always pain within the body somewhere. And so, what we have to do, as those that support those individuals is make sure that they get the proper care. Now, Ms. Bragg, as a parent of a child with sickle cell, please share some of the challenges that you faced, over the years. Now that she's an adult now, but in really trying to provide the proper care for your daughter.
Well, the first challenge that I had to get over was guilt. As a parent, the question was, why my child? And her dad didn't know until she was born. I knew that I was a trait warrior. And I asked him, but he didn't know until she was born.
Right.
And with that, we'll speak about it a little bit later, but another challenge was balancing the two daughters, making sure that neither of them felt neglected in any way.
Gotcha.
And educating myself on the disease to properly advocate for Asia, because a lot of parents, they don't know.
Right.
They don't know where to start. They don't know the questions to ask. They don't know how empowered they really are in the medical field. So just that uncertainty of unknown and keeping her and myself both with a positive mental aspect. There were a lot of times she would say, I'm the only one, because she knew she had hemoglobin SS, but she didn't realize I had a trait. But she was the only one with disease.
The full disease.
And it was, why do I have to go to the hospital all the time? Why do I have to have the blood transfusions constantly? Why me? Why do I feel like this? So especially in the teenage years, the depression and all of that, trying to eliminate those challenges and just making sure that she received the best quality of care possible. And the transition state, you mentioned her being an adult, the transition of her going from pediatric to adult care is a totally different world. And that whole transition was truly a challenge as well. And my main goal was to empower her by letting her know that you have a condition. You still can do anything that you want to do. That the condition will not define who you are. This is not a death sentence. We're going to fight.
That's right.
We're going to learn.
That's right.
And we're going to push through.
Right. Exactly. And I love that part, because again, all it did was redirect her path. It didn't prevent her from going. She just went around different obstacles that others may not necessarily have to go around.
Right.
And I think one thing that you pointed out, but I want to elevate, is the fact that she began to now wonder about herself. And we don't talk about it. And this is something we do with the Sickle Cell Miami Foundation, is we've had groups with sickle cell patients so that we address their mental state. Because a lot of them go into depression. A lot of them go into blaming and doubting and even wavering in their faith because of the challenge that they're facing physically, not realizing God can elevate that status and really bring some glory to it if they, again, we help them understand it's not your fault.
Right.
It was part of God's design, and you're still part of God's design. You're still part of God's plan to push forward. But what would you say would be the most challenging aspect of what you had to deal with?
The most challenging for me was actually
either way,
keeping the positive mental aspect. I can read, I can learn, I can educate myself, but letting her know that this is okay, is not your fault. This is something that you will be able to help someone else later. And just trying to keep a positive and a sense of normalcy in her life throughout the hospital visits. Oh, we're going to this appointment today. We're going to that appointment. And she was blessed to have all of her specialists in one setting at Miami Children's Hospital at the time, which is Nicholas now. But just, I would have her sister go. And if she's in the hospital, they would go and do music and sing songs and just providing some type of positivity to ensure her and reassure her that God chose you for this so that you can be a testament to someone else. But it was when she started seeing other people with sickle cell. I started taking her to the conventions, and she was like, oh, it's not just me. And I said, no, it's not. And that changed her mental of, okay, well, they're doing this and they're doing that. I can do it too. As a parent, you have a helpless feeling at times. And that was challenging.
Right.
Because I know what I'm trying to instill in you.
Right.
However, to see someone else, because she don't see me as a warrior, she see me as mom. And that was a challenge. But to see others as warriors, it was like, okay, now I got it. Now I can do it.
Yeah.
But that phase was devastating.
I can imagine. And now from a grandparent perspective.
Oh, wow.
Same question, and what helped push you through?
That's deep. From a grandparent perspective, because it's the whole family dynamics around it. She was the only girl, and the boys didn't understand. I mean, every time, she had to go to the hospital, keep going to the hospital. One of the parents had to be there. The other parent had to work. And it looked like, a lot of special stuff was being geared towards her because of her sickness. But it's the education of it. And for me, because I was in healthcare, I understood it better. So I was able to educate the family about what she was going through. BiPAP, we used BiPAP on adults. But when it came to them saying, well, we need to put BiPAP on her now to help her breathing. And I'm like, oh, wow, But it was the education related around it. It's trying to hold that whole family dynamics together because they did not know.
Right.
It was that education that needed to be there, and that pain level, like I said, trying to help us to understand it's severe pain. She's not just saying it. It is real. So those challenges is just the family dynamics, holding it all together when the two parents were out doing what they needed to do. As a grandparent, I had to just kick in and try to help to hold everybody together, the kids and everything, and help them to understand it.
Right. And part of my experience has been, and it's not in my family. So much of what I've learned and knew and grew to have to address or advocate for has come through my work with the Sickle Cell Miami Foundation. And I've even received phone calls where parents were at the emergency room with their child and doctors not responding in a manner because they feel the person or an adult who's in the hospital having a crisis and not being given the proper meds, to try to alleviate or diminish the pain. And, I've had to call hospital administrations and say, listen, what's going on? This is a problem, and this individual has reached out to our offices to get them to respond. And so when we deal with this issue of sickle cell and trying to help people get educated, and we realize that there's a national organization, you have your respective organization, and through the work that you do, how can what do you think we need to do more of? Not just to educate people, but to help people understand, not just in the community, but in healthcare. Because a lot of the programs don't focus on sickle cell as deeply as they need to. So what do you think we need to do to address this issue?
Well, the great benefit to that question is the bill, HB 353, that was just passed for the state of Florida, which it is a healthcare bill that provides sickle cell education training and care management to the hospitals, the providers, which is most important because, as you stated, they have an hour, 2 hours during study to focus on sickle cell. I've been at healthcare events where the nursing students or the medical students will come and say, oh my God, can I get information because I have a test and I don't know anything. And that's unacceptable because sickle cell is a chronic illness that is affected by many. And it should be more focused on that. So that bill is the start of the improvement of the quality of care because education is key. And educating the community is one thing, but educating the medical staff,
providers,
and providers, that is key. In health fairs that I've hosted over the years at Homestead Hospital, it will be providers that come downstairs on their breaks to learn about the disease. And I didn't know that. And I was blown away because in my mind, I'm saying, how can you be a provider and not know? But if you're not taught, you don't know.
Amen.
So that education aspect, that's why I went and I got certified as a sickle cell education counselor and certified as a patient advocate, because someone have to advocate that knows.
That's right. Amen. Amen.
Yeah. I went through the experience with the healthcare providers not really understanding the nature of it. When you say chronic pain, that takes you to a whole nother level.
Exactly.
So when my grandson was in the hospital, because he was young and because he was his mind was still saying, I'm gonna fight this, I'm gonna live, not knowing that his body was deteriorating because of the late diagnosis of all of what he was going through. They didn't know how to handle him.
No.
So I had to step in, and the family step in and say, no, he's really in pain. He's not, because he's a young male, African-American male, I'll say dreads, there was a little profile in there. And I stepping in to say, no, that is not him. He is really in pain. He wouldn't be coming to me saying this if he was not in pain. And my hat goes out to you and all of those that put in the effort on the bill, because we're the first state that has done that. And to really put this in on that back end education before you get out, to know that you need to listen to your patient.
Yeah.
Amen.
Not assume that what they're saying is not real.
Correct.
The depression that goes along with it. Through the years, I was disheartened because I knew at least 2 to 3 young men who died because of that chronic pain issue and the depression that went along with it, and working with their family and parents. But to know now that they are listening, to work with clinics like the one they have at South Miami now that participates into what you're doing, LaWanda. But my granddaughter was so happy to hear it, because like I said, she's in Atlanta, and she said, Grandma, one of the things they need to train the physicians about dealing with the chronic pain as it associates with the sickle cell.
Gotcha.
And to hear that they have done that, she was just in awe. Being a nurse and having to tell the physicians what need to be done, what need to be given, she was so relieved to hear that is a movement that is being done. But I'm very happy to just hear more being done with sickle cell. For instance, she went through the donor phase of the transplant, the bone marrow transplant. Now to hear that they got new medications and new way of helping sickle cell patients get through transplant using their own types of cells. I mean, it's amazing to me. I guess that's why I love healthcare. So
and to look at that also, recently there was a report by the former Miami Heat player Carlos Boozer, who used to be a resident here. He had an older son that had sickle cell disease, and I say had sickle cell disease because he and his wife agreed to have another child to use the stem cell therapy to help them get their first child cured. And they were successful in that particular endeavor. But see, he has resources that the majority of people don't have. And so we're looking at that aspect of this whole thing, but also looking at what happens in our hospitals is part of the challenge that we have is from a racist standpoint, or the issue of racism, there's a belief that we still have a higher threshold of pain than people of other races. And at some point, that has to be diminished and eliminated. However, until then, we have to reinforce the fact that we feel pain just like everybody else, and it should be given the same amount of attention that others receive.
But the education and awareness being out there, the more education we have, the more we'll know. We won't be as unknowledged about what we need to do, how we the resources that's available.
I agree.
I work with the Courtney Vega Foundation for over 10 years now with the walk, and we need to get that out there a little bit more. I think you already have it scheduled also too.
September 26th.
Right.
All right. That's when September is?
Sickle Cell Awareness Month.
Sickle Cell Awareness Month. And we just missed Juneteenth, which was what?
It was World Sickle Cell Day. And we did have our Sickle Cell Gala that evening.
Amen.
So, but when you speak about cure, a lot of people hear cure and they assume, okay, if I have this done, then I'm free from sickle cell. And that is not the case.
Correct. No. Correct.
And that have to be explained to the individuals who's going through the gene therapies, the stem cell transplant, the bone marrow transplant. Someone can go through a bone marrow transplant process and their body reject the bone marrow. They have to know
100%.
that these are not full cures. It reduces the crisis that the individual occurred in that individual. And it varies from person to person.
Exactly.
So when you hear cure, it gives hope,
right,
which is a major stride. But in hearing cure, they have to understand the boundaries of that cure.
That's right. I agree.
And that's not what's being explained.
No, and you're correct. 100%. And like I said, no treatment is foolproof. No treatment is 100%. But I guess it's an advancement that gives that child and that family, like you said,
Absolutely.
the hope. I love that word. The hope that their child can live some level of normalcy that others that are impacted by it don't have.
Exactly.
So with that said, and as we're getting ready to close it down, and in this particular this segment, what words would you like to impart or encourage to families, i.e. from a parental aspect, and then you from a consulting aspect as it relates to sickle cell and what steps need to be taken going forward?
A couple things. First, I would like to encourage the parents and providers and anyone watching to know that sickle cell does not look the same for everyone. It is, you have trait warriors, you have sickle cell warriors. And in order to have sickle cell, you have to have two trait genes.
Correct.
And the misconception with that is, as Mickey said earlier, if you have trait, you have nothing. But it's impossible to have something that created disease but not have any characteristics of the disease that it creates.
Right.
So with that, they have to know that every child that they have, there's a 25% chance if two trait warriors come together, it's 25% chance that that child will have disease, 50% chance that they will have trait, and 25% chance that you will have a child with nothing.
Right.
Courtney doesn't have trait or anything.
Correct.
But Asia have disease.
Gotcha.
So
one extreme to the other.
Exactly. So they have to know that every birth is individualized and every chance is individualized.
Gotcha.
And sickle cell is not something that is contagious. It's a genetic disorder, a genetic blood disorder that is passed down from the parents. So, and when you look at the individualization of sickle cell, the treatments are individuals. As we spoke about pain earlier, everyone don't have the same pain. My daughter didn't experience pain crisis until she went to Louisiana and the climate changed. And that's when her pain crisis started. But she's been blessed because it's staff that understands. And they're like, okay, we're going to give you everything that you need. And thank God for South Miami Sickle Cell Care Clinic because it's ran by a pain management specialist.
Yes, I met him.
Dr. Moransky is amazing. And with that is and it is so important and so effective in the sickle cell community.
That's right.
So just giving the parents, yes, it's some down days, it's some hard days, but there's an outcome on the other side.
Amen.
And I thank God for my faith and my belief in the prayers of my family because it carried me through.
Amen.
But just know that you're not alone.
That's right.
And we're here for anyone that have questions. They can reach out to the organization, CourtneyVegaFoundation.com, and ask your questions. We're there to support in any way that we can.
Amen.
If a parent don't know how to advocate for their child, We have certified sickle cell education counselors that can do that on your behalf.
That's right. That's right.
You're not alone. And that's the major, major point to know that I do not stand alone.
Okay. Well, thank you. Ms. Thompson?
I'd like to just indicate that there's a lot of more of education and awareness that needs to be made. Right now, we're going into the football seasons, and coaches need to be aware of the fact that you may have some of your players that have traits, sickle cell traits.
That's right.
The heat has changed.
Mm-hmm.
Heat, we don't feel heat like we've never, we're feeling it like we've never felt it before. Please hydrate them.
That's right.
When they say that they're hurting and they can't go anymore, please listen to them.
That's right.
And we need to do more education to that particular area.
Amen.
Too, as it relates to sickle cell.
Amen.
One last thing, as Mickey was stating, a lot of individuals may not know that we partner with Miami-Dade County Public Schools before Dr. Larry Feldman retired.
Gotcha.
The year before he retired, we partnered with him, and all coaches and athletes are required to watch 4 videos. And one of those videos incorporates sickle cell disease, as well as the athletic physical was changed. And now all of the physicals have the question, do you have sickle cell disease? Do you have sickle cell trait? So the education is getting into the system slowly but surely. And that's one of our greatest accomplishments with the foundation.
Amen. Well, thank you for all that you do in advocating for sickle cell. Thank you for the work that you continue to do as a consultant. And more importantly, we want to thank you for raising and elevating the conversation so that the people will know and the people can respond. With that said, this is our edition of the Empowerment Zone. Thank you, and we'll see you at the next one.
Thank you for joining us in the Empowerment Zone, brought to you by South Dade NAACP, where information becomes action, voices become movements, and community becomes change. We hope today's conversation inspired you to stay informed, stay engaged, and stay empowered. Remember, our voices are strongest when they are heard at the ballot box. Voting and voter registration are powerful tools that help shape our schools, neighborhoods, leadership, and future. Encourage someone to register, make a plan to vote, and continue doing your part to strengthen our community. And don't forget to email your feedback, thoughts, and/or suggestions for topics that you want to hear about to podcast@southdade.naacp.org. Until next time, keep listening, keep learning, and keep leading, because together we are building a stronger South Miami-Dade, one conversation at a time.